Janice wants to know, do you have supplements to lower blood pressure?
Broad answer is yes.
Good, moving on. No, I'm kidding. I'm kidding. This is Generation Health. Every week we bring you the latest in news, cutting-edge research, and time-tested best practices to help you live a better and longer life. Sitting across from me, Mr. Joey DiMatteo, registered pharmacist, board-certified clinical nutritionist. How are you, sir?
Very good. How are you, Tyler?
I'm good.
Glad to hear it.
And to my right, Dante DiMatteo, registered pharmacist, certified strength and conditioning specialist. Good morning, sir.
Good morning.
And I'm Tyler Andrews, your host and producer. And this episode, this is one of our fun ones. I love doing these. This one is all listener questions. This is the second time we've gotten to do an episode exclusively dedicated to things you guys want to know. And that is all because you send us those questions. So again, please email us questions at askjoedimatteo.com. Should be right there at the bottom of your screen. Or if you're not watching, you just have to remember questions at askjoedimatteo.com. But first, before we let other people ask questions, I need to know, what's your favorite quotation and why? Popular quotation, not something you said. You can't quote yourself.
But if I find it on the internet, it counts.
If somebody else quotes you.
No, I definitely heard of the first guy, but
one time I said,
my favorite quote.
One of my own.
That's it.
Something I said.
So I'm going with a Jordan Peterson one.
Oh yeah.
And I don't know. I can't say I have one that rings in my head throughout the day every day, but definitely do save them sometimes when I see them on Instagram or things like that. So I did have this one saved. And it, does pertain to kind of where I'm feeling like I am right now. So it says, can you imagine yourself in 10 years if instead of avoiding the things you should do, you actually did them every single day?
Yeah.
So, I mean, to me, that's pretty clear. I mean, work and business, there's things that need done. My physical health, something I need to improve and get back to where I want to be and where I was a few years ago. Parenting.
Yeah.
Just the day-to-day of parenting. And sometimes, I fall into the mode where it's just like survival or just playing, but maybe not quite parenting, but just trying to make sure that I'm enjoying the moment with them, saving money, budgeting money, those kind of things that, if I did what I know I should do, imagine where I would be in 10 years. But, so it's just about starting it and doing it daily. And then I did get a second one here too, because it goes along with it in a little way, regarding kind of staying in the moment. Just I could tend to kind of always be in the past or forward. But the quote it's by Eckhart Tolle. I'd never heard of him. But most humans are never fully present in the now because unconsciously they believe that the next moment must be more important than this one. But then you miss your whole life, which is never not right now.
Huh.
So for me, again, with that tendency to be looking forward or back all the time and almost like an ability to be in the moment at times. That's that one hit me. So
that's good stuff.
Yeah, it really is.
That's good stuff. Dante?
I used a sort of a cop-out answer, one that I've used before.
Are you quoting yourself? You can't quote yourself. That's not allowed.
Yeah, there was this one time I once said to Josiah. No, this one's from James Fitzgerald, who was definitely an influence, like fitness-wise and life-wise, and he's just a pretty cool guy.
Mm-hmm.
And he once said, "Move not because you should, but because you can."
Yes,
the infamous.
Yep.
And so there's many days where, training-wise, it would be easy not to show up or skip it or skip an exercise or skip a Metcon, whatever. Whatever's not feeling too good for the specific day, but just not forgetting that it's a privilege to be able to go do that kind of thing. It's an opportunity to go express yourself physically. And I have to pretty much think of that. If I go to the gym and I'm thinking that every single day, then maybe I need to scale it back a little bit. But in general, it's a privilege to be able to go move weight around and do stuff and move in general. So,
and that applies to not just exercise. I mean, that works with all kinds of things. Spend time with your spouse, not because you should, but because you can't.
Yeah,
definitely.
Spend time with your kids. My kids are moving out, so I feel that. That's that. Ever since you first brought that to my attention, I've actually thought about that multiple times when I didn't want to go to the gym. So good. I'm glad that he brought that one back.
Yeah.
I had to scramble real quick. Even though I am the one that chose this question, I hadn't actually pulled up my answers. I have the answers. I knew what they were, but I have two as well. The one that everybody knows is the man in the arena question. I love quote. I love that one from Teddy Roosevelt. It is not the critic who counts, not the man who points out how the strong man stumbles or where the doer of deeds may have done them better. The credit belongs to the man who is actually in the arena, whose face is marred by dust and sweat and blood, who strives valiantly, who errs, who comes short again and again, because there is no effort without error and shortcoming. But who does actually strive to do the deeds? Who knows great enthusiasm, the great devotions, who spends himself in a worthy cause, who at the best knows in the end the triumph of high achievement, and who at the worst, if he fails, at least fails while daring greatly, so that his place shall never be with those cold and timid souls who neither knew victory nor defeat. Remember when presidents used to talk like that?
I mean, jeez.
That is incredible.
It is.
And then my other one is actually from this is my real favorite quote. So I have a favorite president, and his name is Calvin Coolidge, and nobody likes to talk about him, but he was the bomb, and you should learn about Coolidge.
What years?
1925 to, well, okay, no, he actually took over for Harrison that left, who died in office. He was the vice president for the last, I think, 18 months or something like that. So technically he was president from 24 through 29, I believe.
Then FDR?
Yeah, then, no, then it was Hoover.
Okay.
And then FDR.
Okay.
But Calvin Coolidge, this is actually, I just read a biography on him last year, and they said that this quote probably wasn't him, but it sounds absolutely like something he could have said, so he gets the credit. Anyway, the quote is, "Nothing in this world can take the place of persistence. Talent will not. Nothing is more common than unsuccessful men with talent. Genius will not. Unrewarded genius is almost a proverb. Education will not. The world is full of educated derelicts. Persistence and determination alone are omnipotent. The slogan, 'Press on,' has solved and always will solve the problems of the human race." So, keeping at it even when you don't want to, because that's the only way you're going to solve the problem. I love it.
Those are good. Really
yeah,
good.
Man, that second one especially hit me. I never heard that before. That's really good.
Yeah, and whether he said it or not, he gets to take the credit.
Oh yeah, it only matters so much.
Yeah. Anyway, all right. Well, that's a fun diversion. Let's talk about Debbie's email. Debbie emailed us at questions@askjoedimatteo.com. I'm going to plug it as many times as I can. You guys, we need as many questions because I love doing these. She said, "Good morning. I love your podcast." Thank you, Debbie. "I was viewing all of your probiotics, having some gut issues, but don't know which probiotic would be good for me. All of your products are great, but I am confused as to which probiotic is good for what condition." All right. Well, let's see if we can help her out.
That is a great question. Yeah. I mean, essentially, first part, you can just very quickly go over what a probiotic is.
Yeah.
I know most people do know that, but it is good bacteria.
Right.
That's first and foremost. I think secondarily, though, it's important to use this term of a microbiome. Our body is literally a microbiome because the bacteria, good bacteria, is a microorganism, lives in colonies in our body. So, I mean, that's in the most broad sense what a probiotic is. What do they do? Again, broadly, they improve immune function. They literally interact with intestinal immune cells. They also protect against hostile bacteria to prevent infection, whether it's typically in the gut, but also you've got some good bacteria on the skin, the mouth, the ears, nose, etc. So it can directly eliminate some of the bad bacteria, which is pretty interesting, but it also competitively eliminates them. Essentially just kind of overwhelms them via population, resources that they need, etc. Creates a better balance. All right. So again, you've got immune function, you've got protection against hostile bacteria, and then thirdly, improves digestion as well as absorption of food and nutrients.
Okay.
There's more coming out that there is evidence that there's a gut-brain axis that the gut and brain are communicating.
Yeah.
So that's even now, not just for digestion. We kind of knew that, but more and more for mood swings and things like that. So that's even kind of an emerging probiotic role. So that's the gist of, again, what they are and what they're used for.
And they're just a pill form typically, right?
Yes. Yeah. They're essentially powder. So whether that you can technically do some in jar scoops, etc., but it's much better protected when it's encapsulated properly, especially ours are enteric coated.
Okay.
So it really allows for, that's why almost all of ours do not need refrigerated. So
got it. Okay. All right.
So in terms of, which one to use, that does get a little complicated without knowing a little more. And as you just said, digestive issues. So when you're looking at anybody with digestive issues, once you go over some of the symptoms, obviously, then that allows you to give a better recommendation. But what we would recommend broadly is a multi-strain probiotic. Our probiotic essentials has 11 different strains. Your body needs more than just one or two. So from a basic standpoint, if you're just saying, hey, I'm having some mild vomiting, some mild diarrhea, etc., I just want to try something, you can do something like that. Other people are a lot more specific. They're having, some chronic issue. They know that they just had, a condition where they were on an antibiotic for a couple weeks, or maybe they have recurring, or maybe, somebody younger has been taking it for acne, et cetera.
Sure.
So, in those cases, you may want to do a little bit of a reset where you could really hit it hard and do something like 225 billion units for 15 days, do 100 CFUs, 100 units for about a month after that. And then you can go down to the regular probiotic. So that's more kind of in a reset standpoint. So again, there are a lot of different ways you can go given the product and given what the issues are.
So it really depends on what your specific issues are, which ones you need. Are there any that, any that we can really quickly go, this one is really targeted for this specific situation. So if that's not you, we're not talking about that.
Definitely. Yeah. So if you're having issues maybe with some indigestion or poor digestion of food, we do have a combo with enzymes.
Okay.
So you can look, do that one. So they're together. The enzymes need to be in your gut at the same time.
Got it.
We also have a probiotic, Women's Pro.
Yeah.
The reason for that, these bacteria do congregate in a female's vaginal tract. So we know that it's mildly acidic in that area. So the lactobacillus strains are ones that are going to survive there. So it's not going to be a cure for yeast infections or UTIs, but it does help to balance, to reset the flora in the area. And you've oftentimes used an antibiotic if you had a UTI. So it kind of resets the local area there.
Got it.
Then we also have Ultraflora Immune Booster. So that one is for strains that congregate in the nasal and sinus passages.
Oh, okay.
So yeah, I'm kind of going to keep. We have Probiotic Pro Sport for SIBO. That gets complicated. We have talked about SIBO before.
But that's specifically for SIBO.
Specifically for SIBO, yes.
Okay.
Yeah, it has IgG, so immunoglobulins, and it has bacillus strains, specifically, for a reason. So then we have also a different kind of twist. It's Saccharomyces boulardii.
Okay.
It has the properties of a bacteria and a probiotic, but it technically has a yeast cell wall. So that is, and it's documented to survive human body temperature, gastric acid, as well as digestive enzymes. Okay. And the important thing about all that is because it largely congregates in the colon. So if it can survive the oral use
a long ways.
Exactly. It can survive. We know it can survive oral use because it's been looked at, through those phases. So that's very useful if you're on an antibiotic. It's not a waste to take a probiotic while you're on an antibiotic, but you kill a lot of it. So a lot of it is going to waste. When you take this, it's going to help congregate in the colon, eliminate some of the digestive issues, diarrhea, et cetera, that you get with antibiotics. So it helps with that. Also, if you have C. diff, obviously a very serious condition, but you can use it for that as well. So that one again has a very specific use.
Very cool. Okay. Did we cover all of them?
Yes.
I think
believe so. Yeah. We changed them. I mean, it's even for me, I'm going through and refreshing because we're adding new ones all the time. We've kept our base one, the 11 strain, probiotic essentials the same, but yeah, I mean, we've been adding and changing a lot.
As new data comes out and new information and its manufacturing processes are available to be able to keep these stable and transportable, it makes sense that we would want to update that stuff.
Definitely. And just one other thing.
Yeah.
I do want to mention medications. If you are having gut issues that are potentially affecting gut flora, obviously we touched on antibiotics, but that's, has to be said. Oral contraceptives. Also, if you are on one, be something to be very aware of that it can cause issues with your gut flora. Essentially, to get too technical, but beta glucuronidase is produced in the gut and can recycle estrogens. So if you have an imbalance of bad bacteria and you're secreting a lot of that beta glucuronidase, then you could end up recycling your estrogen. So you take your pill, the liver starts the process of breaking it down, goes to the intestines for elimination, but then it gets turned back on and recycled by beta glucuronidase. So that's been documented that Lactobacillus acidophilus can help to decrease the activity of beta glucuronidase. So there's again some real specific things.
Yeah.
If you unpack with somebody, you can get a lot of use, out of. So PPIs as well, used for GERD very commonly. That can definitely affect gut flora, and heavy alcohol use as well.
Of course,
a physical thing, having alcohol in your gut.
Yep. Makes sense. That makes sense. Debbie, I hope that was helpful. If not, you can always call the office or email us directly and we'll get you squared away there. But lots of great options, and hopefully that helped. This email is in from Cheryl. Dante, I'm going to point this one at you. Good morning. Can you talk about intermittent fasting? I've read many articles and listened to another doctor who recommends it to his kidney patients. Are there benefits to pre-diabetics and or weight loss? Also, I heard you mention Ozempic at the end of the last podcast. That would have been a few ago now. I was interested in this drug, but after doing some research, it looks like it makes many people sick. I'm not sure if it would be worth it. I need to lose about 30 pounds. Can you talk about the various diets, keto, etc.? I'm trying sensible eating, but not making much progress. Thanks. Keep up the good work. Making your dad proud. Well, thanks, Cheryl. That's fantastic. All right, Dante, we'll break this up. There's two big questions here. Starting with the first one. Can you talk about intermittent fasting? Is it good for kidney patients, people who are pre-diabetic and or weight loss?
Yeah, good questions. So I think a key point to start, much like keto, carnivore, if it fits your macros, which was popular back in the day, and similar with, intermittent fasting, you'll see strong opposition to anyone who, puts forth some sort of counter argument or tries to downplay.
Yeah. If you make a stand, you're going to have somebody fighting you. Definitely. So intermittent fasting is, like many of the things we've talked about is a bit contentious. It's kind of crazy. Just a dietary intervention could be so controversial, but I digress. My input here, I wanted to try to be as thoughtful as possible, not trying to shoot this down in any way, but just present something that's, I think, fairly balanced. So here's the reality. There are a wide range of meal frequencies that can be effective in helping somebody meet their health or dietary goals. So what you're saying is there's nothing magical about intermittent fasting specifically.
Yeah, unfortunately not. So it's really just it can be a very powerful tool to have, in the arsenal. So to get a little more granular here, I kind of broke this down into 3 questions. So what is intermittent fasting? Why are people doing this and why do they care about it? And then does it actually work? And so in Cheryl's case specifically, is this something that's going to work for pre-diabetes or diabetics or weight loss? So basically, intermittent fasting, what it is essentially is alternating between voluntary fasting and non-fasting periods. So the most common ratio that we'll see is a 16 to 8 hour ratio. So 16 hours without consuming any sort of food or food products with significant caloric value, and then an 8 hour window where essentially you can eat whatever you want.
Right.
So that's the most common form that we'll see. Variants of IF, and I'll refer to intermittent fasting as IF at this point, but two of the most common variants would be time restricted feeding, which essentially shortens the window of feeding to that roughly 6 to 8 hour per day window, and then whole day fasting, which is pretty self-explanatory.
So when you're saying 6 to 8 hour window, what you're talking about is like somebody who says, okay, I'm not going to eat anything until noon, and then I'm going to be finished with my dinner by 6 p.m. or 7 p.m. And that's it. So after whatever time, 7 p.m., I don't take another bite of food until noon the next day.
Exactly.
Okay.
And so really in that window of not eating, the only acceptable food, the only acceptable products are really like anything that doesn't have calories. So water, diet drinks, maybe like coffee, potentially that sort of stuff. That's about it. One other thing I wanted to mention here as well, it's not technically intermittent fasting, but intermittent energy restriction. We often see interchangeably used with IF as they obviously sound very much alike. But basically, and the reason I mention this is because it's like there's so many variants of this that can be tailored to somebody's needs. Yeah. And so that's why I'm not really quick to like shoot down intermittent fasting, because first of all, it's like, what form of intermittent fasting are we even talking about? Is it the 5 to 2? Is it this intermittent energy restriction where you take,
5 to 2 means eat for 5 days and then take 2 days off where you don't eat. Mm-hmm. Yeah, there are
so many.
A ton of variations of voluntarily fasting is the idea.
Mm-hmm. Exactly. And so then this other aspect, intermittent energy restriction, which can be a very appealing option to someone trying to lose weight. You basically have on weeks and off weeks. Okay. And so you're not eating for weeks at a time, but you essentially have an on week where you're eating at maintenance. And then you have another week where you're eating at slightly below maintenance each day. And then, or you could do 2 weeks on and you're eating at about maintenance. And then you have 2 weeks where you're, substantially below maintenance or a little bit below maintenance. There's so many ways to average out that caloric intake that can be very well suited to somebody's work schedule or preferences, or maybe they have vacation coming up and they know that maybe that's going to be a week or two of, indulgence of a little, like irregular indulgence, let's just say. Yeah. So, to kind of recenter here, why are people doing this? So firstly, fasting as a whole obviously is not new. It's been practiced for centuries by various cultures and religions. And you guys could back me up on that. Oh yeah. Now the rise in its popularity as a health practice specifically has really shot up over the last decade. And I think this is due to the notion that IF might confer unique benefits with respect to meaningful clinical outcomes when you compare it to a traditional dietary pattern or caloric restriction. So it's just that there's like this nebulous benefit of doing this that separates it from any other sort of dietary intervention. It's like similar to the, some of these other fads that have like this, this really powerful thing that's getting people to take part. But logically, I think intermittent fasting makes sense. The thought is that our bodies, when without food or nutrients for an extended period of time, we can more efficiently tap into our body's energy stores. And so something like this will aid in weight loss or, help somebody maintaining a healthy weight. It's just the idea that giving the body time in a fasted state between meals makes sense. It's generally advisable. Yeah. And that's because there are physiological processes that maybe we won't get into today that take place in those fasting windows. And so whether you're fasting technically like 3 to 5 hours or 6 hours or whatever it is between meals, or if you take it to the, the other end of the extreme, like 16 hours or so. There are things happening under the hood that are valuable. And so this wasn't like pulled out of nowhere. It has historical meaning, it has religious meaning, and it certainly has a basis in, whether you just want to call it like mechanistic data or, what am I looking for? Like mechanistic, practicality.
Sure.
It has the basis.
It works
scientifically in addition to just like this cultural influence. So, and the final thing that I'll let you jump in. The final thing that I'll mention there in that regard is that, and I guess this is kind of an aside. I'm under the impression that snacking. So if we refer to snacking as whatever you're eating in between meals. Yeah. This is just a good practical example of why that's not really advisable. You want to leave distinct windows, or you want to leave distinct periods throughout the day for eating. And when you start to snack between your 4 and 6 hour meals, then when can you ever enter that, that fed state or that fasting state where we know that there are important processes that occur? Yeah. It allows your insulin to sort of normalize. It helps maintain insulin sensitivity. So, all of the stuff that I'm mentioning now, those are all proponents towards, why fasting, whether it's 6 hours or 16 hours, has a potential for benefit.
Okay. Makes sense. So does it work for things like prediabetes and weight loss? Yeah.
So the short answer is yes, it absolutely can. Now the bigger question there is, does it actually work better or carry distinct benefits when compared to these other methods?
I guess that's a better question.
Yeah. And so the short answer there is, the benefits are trivial, really. So again, it's certainly a useful tool for the right person, but there's nothing inherently beneficial per se about it compared to somebody who's able to just restrict their calories, let's say. And I have some more stuff to
go ahead
unpack there.
Go for it.
But ultimately, and not to be too reductionist, but the thing with intermittent fasting is that for most people, it'll result in a spontaneous reduction of caloric intake. And that's huge. That's the crux of it. And so when I say spontaneous reduction of caloric intake, that basically just means someone's not necessarily trying to eat less. It's they're following their windows of eating and not eating.
Yeah.
And because of the way that that's structured, they don't even have to think about consuming a caloric deficit. And so that can really help somebody prevent having to micromanage their caloric intake, because if you're not eating 16 hours of the day,
right,
it's going to be pretty challenging to eat 3,000-4,000 calories in 6 hours.
Right.
I mean, even if you're the hungriest person on earth, it'll be tough, especially initially.
If you're averaging, say, 800 calories a meal, that's 2,400 calories a day. And if you just cut one of those meals out, even if you up the caloric intake on the other 2 meals to 1,000 calories, you're still at a deficit from what you were before.
Definitely.
That's what you're saying, right?
Yes.
Okay.
Yes. And so this is the crux of why I think this can be a very useful tool. Somebody who's I refuse to count calories. I may have prediabetes. I may have a little bit of an issue with glycemic control. And hey, maybe this is something you talk to your doctor about. I think that's valid. But again, I want to drive this point home. It's this reduction of caloric intake that really carries the weight in terms of the benefit. And that's basically what we see across all of the IF research and all the dietary research that's compared. What matters more is actually achieving the caloric deficit or the appropriate caloric intake versus how you actually got there. So whether maybe you did some sort of keto hybrid or carnivore hybrid, and it got you to a caloric level where you could regulate your body weight, you can regulate your glycemic control, you can, you were eating a little bit less saturated fat, and it started to improve these markers of, or your blood lipid markers and such. And so it really came down to the overall caloric intake. There was a meta-analysis done by Headland and colleagues that looked at trials lasting longer than 6 months, which is a pretty significant amount of time. And it revealed that IF did not alter blood lipids, glucose, and insulin to a greater degree than standard daily caloric restriction. And so that's a very broad stroke of what that meta-analysis looked like. And then there was another trial by the same author that revealed that there was no significant weight loss when comparing these different styles of equated caloric restriction. So if there was a diet that got you to the same caloric levels of what you achieved with intermittent fasting, you saw the same outcomes with respect to glycemic control, blood lipids, weight loss, cardiovascular risk factors. So when all things are equated, it's hard to find what that silver bullet of intermittent fasting was really, set out to achieve.
Okay, so let me see if I can sum up what you just said, because she's asking, what is it? Is it useful? Does it work? And the answer is, it's voluntarily not eating for a period of time. Totally up to you what that looks like. And does it work? Yes, sort of. It's not a magic pill. There's nothing unique about it beyond that it makes it easier to eat fewer calories in a given period of time.
Right.
And that what actually works in all of these situations is caloric reduction. That by eating fewer calories than you burn, you lose weight over time.
Yeah.
Your glycemic control increases, your response to sugar and all that improves, your lipids go down or up, depending on which one we're talking about. That ultimately, if you want to weigh less, you have to eat fewer calories. And what that looks like for you just depends on what works for you. If intermittent fasting works for you and is an easy way to do that, knock it out. If you can voluntarily restrict to a smaller caloric portion per meal, do that. But the bottom line is, it's just a tool. It's not anything unique, magical, or wonderful that you might have heard.
Yeah, absolutely. I mean, that very well said. And to, sum that up even further, it is generally safe for most people. So if that's something that she wanted to try, I think it's well within reason for her. Now, she did mention pre-diabetes. There is a chance, because of these drastic reductions and increases in the amounts of food that you're consuming, that the potential for hypoglycemia and hyperglycemia for somebody with pre-diabetes, that is something to watch out for. So that's sort of why I kind of hedged my bet with saying, at least talk to your doctor about it as well. Again, especially if you're in the pre-diabetes range, or if you do have diabetes.
So if she's in that pre-diabetes range, you're not going to, once you start eating, all of a sudden just pound the sugar and spike that blood sugar, and then you go back to fasting and it's dropping down like a rock. You want to exercise some reasonable caution here.
Definitely. And I know there's somebody out there saying too, like, well, I heard that intermittent fasting can lower my body's inflammation.
Yeah.
That's the main reason I'm doing it, is because of the systemic inflammation. Honestly, I would have to look a little further into that, but my broad search of the sort of the literature there, it's true, but it's also is something that's a little overstated as well. Like systemic body inflammation and the measures that we look at in those situations, a lot of that is so complicated.
Yeah.
And we're trying to look at things more broadly than just like these little transient minute to minute changes in inflammation and those sorts of things. So yes, it can definitely help with inflammation. However, you're specifically defining that will depend. It can help, but similar to the other outcomes that we talked about, I think a tempered expectation is useful there.
Fair enough.
So
let's hit the second part of this real quick. She got an in-depth answer on that. Tell me about Ozempic. I know we've talked about it before. She was interested and then saw that a bunch of people feel very sick when they take it. She's got 30 pounds to lose. What is the suggestion for her? Should she be on Ozempic? I know you can't specifically say, yes, you should take a drug. That's not the way that this can be handled, but.
Just hearing about somebody's side effects or, some sort of anecdote, positive or negative, it's like you have to kind of take with a grain of salt.
Right.
I think maybe given, her health metrics and, where she sits on that spectrum, it sounds as though it could be a good option. There's more than Ozempic now. There's the Wegovy, the technical, weight loss approved version of semaglutide that has a little more flexibility in dosing.
Yep.
So it might be useful from a side effect perspective that they titrate her up slowly using those different dosing. So that's one way to mitigate some of that. But as with all medications, it's or new initiations of treatment, there's always a non-zero risk. And, you take calculated risks with this, but the fear of side effects, I think in this case, I don't know how much good that's going to do for her, because if she were to start and she felt like crap and just couldn't quite shake that, you can always kind of switch gears.
Yeah.
I do think it's something that she should at least talk to her doctor about.
Okay.
You know what? The one part I didn't want to gloss over was that, how much that intermittent fasting could help with caloric reduction. Like that's kind of the crux of all this. It's so difficult given the landscape and the society that we live in. It's hard for anybody to just spontaneously reduce their caloric intake, again, due to a multitude of factors. So whether it's intermittent fasting or something like Ozempic that can help somebody basically spontaneously reduce intake, I mean, like that's no small feat.
Right.
So those are two key links here between both of her questions is how effective both of those things can be with reducing intake. And in her case, that's, ultimately what the goal would be.
So again, there's not because she asked about various diets, keto, et cetera.
Yeah.
Same answer. There's not a magic bullet. The point is you've got to eat less than you burn. And if that's through intermittent fasting or using a restrictive diet or taking a medication like Ozempic or Wegovy that allows you to feel full and not want to eat, whatever the case may be, there's really only one way to reduce body weight other than surgical interventions, but we're not talking about that.
Right. Which is an option, but not, I think that there are things before that you could potentially do. And you did mention one of the specific side effects that not just the nausea, vomiting, like those sorts of like very unpleasant things. The one side effect that's getting a lot of attention, at least in my bubble, is the decrease in muscle mass that apparently is occurring, that the extreme loss in lean muscle mass that might be occurring in patients that might be deterring people from using it.
Yeah.
It's strongly recommended to continue resistance training and still, consuming adequate protein and all that sort of stuff. So it's certainly possible to lose weight, sustain the weight loss on these medications, and maintain and then begin to build lean muscle mass as you progress on this. This isn't like a 2-week thing. It's going to be a process.
If somebody's hearing about that, I saw that same thing. Yeah. If somebody's hearing about lean muscle mass loss, the answer is, that can happen. So keep exercising.
And it's still, and it's still, you definitely don't want to lose sight of what the goal is. And that's to, achieve the body weight goal and all of that as well.
Cool.
And glycemic control.
All right. Joey, Janice wants to know, do you have supplements to lower blood pressure?
Broad answer is yes.
Good. Moving on. No, I'm kidding.
So, but individually, as feel like a broken record sometimes whenever we say this, but more information. Is she on medications?
Sure.
Those kind of things. What medications is she on, et cetera. So, obviously knowing that we're not going to have access to that, we'll just kind of go over maybe a little more broadly. Because the ideal time, to get somebody, essentially, and we say this in the pharmacy all the time, is like right before you're going to start. So you say, hey, I went to my doctor. It's my second time this year, and he's nudging me to take this med, and he's telling me lisinopril, and what should I do?
Right.
In those situations, number one, the priority is certainly to get the blood pressure down.
Right.
But at that point, you do have a lot of options, I believe.
So you're saying before medication has been begun.
Because then we have other people come in and they're on 3 different classes of blood pressure meds.
Right.
And they ask, do you have anything for blood pressure? And then I can't look them in the eye and tell them yes, without telling them that they're asking about a little hammer whenever they're already have a couple sledgehammers. You know what I mean?
Yep.
So that's the key thing. But the most foundational recommendation would be magnesium.
Yep.
It's a mild, natural calcium channel blocker. That's just a fancy way of saying has some similar action as to a class of medications that are used for high blood pressure. Only real side effect you'll see with it is loose stool. So if that does occur, especially initially, you just kind of drop the dose a little bit. But if you're using it for blood pressure, would like to see you get up to 2 or 3 of our capsules twice a day.
And it's the Mag Essentials?
The Mag Essentials, yes. And the reason for the Mag Essentials specifically is that it has multiple forms of magnesium. Cool. So what you're trying to do is you're trying to make sure that your body can absorb the magnesium via different pathways. So we've got malate, citrate, lysine, glycinate. So your body can utilize different pathways to get the magnesium in. Whenever you take just a regular old, like off the shelf magnesium oxide, you're getting a little bit of a laxative effect. You're only using one pathway.
Right.
And that's kind of where the issue can come in.
Okay.
So the Mag Essentials would be the most foundational thing to recommend. And with something like this too, it's like fish oil or probiotics. When somebody asks me or I'm talking about a given supplement for one specific issue, but it's a supplement that can do so many things, I feel remiss not at least mentioning that.
Yeah.
So, I mean, you're talking about magnesium. It's involved in 300 enzyme reactions in the body.
Yeah.
So it's involved in so many different things. It can help you with relaxation during the day, sleep at night, bone health, stress and anxiety, muscle cramping, all those things. Because honestly, magnesium deficiency is just very common nowadays. Alcohol use, caffeine use, coffee itself being acidic, processed foods, sugar, all of those delete magnesium stores, not to mention medications, PPIs, metformin, et cetera, that are all going to deplete it too. So as a society in general, we've got a high need for it. And sometimes, I'm not saying that's the cause of high blood pressure, but in certain individuals and in a global sense, can definitely be a contributor.
Okay. So start with Mag Essentials.
Yes.
Anything else that should be considered?
Yeah, there's still a handful here, honestly.
Oh, okay.
Yeah, next in line would be CoQ10.
Yep.
If you're using it for blood pressure, I would do 200 milligrams, or you could do the CoQ10 Advanced. Ideally, it's in 100 milligram.
Okay.
But it's a better form. It's got a precursor in it, the triple G as well. So CoQ10, again, you're going to get other benefits. It's an amazing antioxidant, really good for the kidneys, et cetera. It's got a lot of other benefits, good for the mitochondria, muscle producing engine of the cell.
Mm-hmm.
So more specifically, if you're looking for something that's just directly for blood pressure, a little more of a heavy hitter, would be a product called Citranos, but really what it is, it's L-citrulline is the main ingredient, along with a patented form of a grapeseed extract.
Okay.
So the L-citrulline is essentially functioning like a precursor to L-arginine. We'll get a lot of questions, or people really hear about, and there's a little overlap here with ED.
Okay.
Because of the way what you're trying to do when you lower blood pressure is to relax the
blood vessels.
Yes. So there's some overlap here in terms of maybe if you're looking at the website, you're looking up the ingredient. You say, hey, I'm looking for blood pressure wise. It's popping. All right. So that could be a side benefit as well. But so L-arginine, great. In theory, body passes it very quickly, very short acting. Liver doesn't allow large amounts to pass through the body either. So it's very self-limiting. L-citrulline though gets around that. Got to take 2 twice a day. You recommend 3 grams. So it's a lot in that regard. And then the patented grapeseed extract as well is going to help with lowering blood pressure. So the other thing too, both of these, they also have shown to not just, as critical as it is, just lower your blood pressure, but it also is involved in endothelial function. So basically that's like the inner lining of your arteries.
Okay.
And they found that in when you're talking about endothelial dysfunction itself, you're talking about the coronary arteries. It's not going to obstruct, but it can narrow via the lining, endothelium constricting.
Okay.
So those things have all been seen, in use with these products whenever because they're raising nitric oxide. That would be the key thing I've got to mention there is the mechanism. So 2 twice a day if you're going to do it. Again, can be used for ED as well. And then secondarily, kind of going in order of kind of recommendation would be blood pressure support. It's another combo product. It does have magnesium in it. So if it ends up being that you're going to do magnesium and blood pressure support, just be aware, cut the magnesium like in half, depending on what you're doing. I'd cut it about in half. So magnesium, taurine, hawthorn. We've been using this product for years. Recommend 3 a day though. Again, you've got to get all those ingredients in.
Right.
So 3 a day. But we've had great success with that over the years. It's just kind of, there's the newer things have come out, like that citranos thing I mentioned. That would be from a specific blood pressure standpoint where I would go first. Yeah, last thing, Core IR. It's a little more broad. So if you're dealing with more of a metabolic syndrome type, you've got a little bit of high blood pressure, got a little bit of high cholesterol going on, so your numbers are off. Some weight issues. Core IR, which main ingredient is berberine, can be used kind of as not a catch-all. You've got a lot to do there, but helps with blood sugar and with lipids and with blood pressure.
Okay.
So it's great from that standpoint if you're dealing with a little more than just some high blood
just
pressure.
One thing.
And then of course, weight, diet, exercise.
Yep.
That's always the boring answer nobody wants to give, but is critical with high blood pressure.
Yeah. Yeah. It's critical with so many things. Yeah. But, and you were just saying all of that is understanding you're not already on blood pressure medication. If you're already on blood pressure medication, it requires a much more specific conversation.
Exactly.
And we got to take it slower.
Yes.
Makes sense. All right. Dante, Joyce wants to know what she can take for energy.
Yeah, this is definitely one that would ideally
Caffeine.
require. Yeah, I mean, that's on. I have that.
Yeah. Do you
as
really?
a recommendation?
Look at me.
Why not?
Oh, okay. Yeah.
But yeah, we would want to be thorough with a kind of a complaint like this.
Why do you need more energy?
Right. Fatigue, lack of energy, it could stem from a million different places. I think Joyce Gibb would look at, lifestyle factors, sleep habits, maybe sleep apnea, maybe do some blood work if warranted.
Yep.
You'd want to look for things like diabetes, hypothyroidism, adrenal insufficiency, etc. Now, if Joyce is non-pregnant, otherwise healthy, I don't think that...
Question, ask her, Joyce.
Yeah.
Joyce Gibb is also non-pregnant, but that's not what we're talking about.
Shout out Joyce. Joyce, both Joyces.
Yeah.
So caffeine, coffee, I really don't think is a bad idea. If you can tolerate it pretty well, or you start with a low dose, again, non-pregnant, otherwise healthy, no contraindications like that, which pregnancy is sort of the main one.
Mm-hmm.
Upwards of 400 milligrams a day is safe. It's incredibly hard to reach like a toxic amount of caffeine. So I don't think it's that big of a concern, not telling Joyce to drink 4 monsters
right
to combat that. But I don't think that that's a terrible idea. I think that something else that can really help would be to continue or to start exercising. But in this case, dealing with some additional fatigue, lack of energy, I think it's important to strive to find the right dose of exercise.
Mm-hmm.
Because again, something that potentially if you bite off more than you can chew to start can leave you feeling a little more tired, a little more achy, kind of doing the exact opposite that you would want. So initiate some exercise or continue exercising. We know that can definitely boost energy, can boost mood. It'll, help with all that kind of stuff that we will often talk about. From the supplement perspective, that's a tough one. I really think this is again, something that you would want to have evaluated. And then from there, if you're good to go and there's nothing pressing, I don't think there's anything wrong with bumping the caffeine from time to time.
Makes sense.
And continuing to exercise.
Cool. All right. Joey, Pam, I think this was from Facebook, said, I'm having trouble with diarrhea when I take your Mag Essentials. Do you have a magnesium without citrate?
That ties in nice.
Yeah,
with my last question of magnesium.
I didn't know that was going to work that way, but...
So... there's very little citrate in the Mag Essentials.
Yep.
So I would definitely say try to rule out some other causes, whether medically or maybe just stop taking it for a few days, et cetera. Just really try to pin down that indeed it is the citrate. I get it. When you look up magnesium citrate, it's going to tell you it's a laxative, all that, and it is. Then you see it in our product. You're getting a little loose stool. I get it. But again, the 235 milligrams that's shown per 2 capsules on the supplement fact label it's just telling you the total. There's very little citrate in there. So again, we'll go with that. It is the problem. And first, we're just a little bit backing up into why it's in there. Because it is not a great absorbed form of magnesium. It's in there. Back to the answer I said prior, that it's the multiple forms.
Right.
So you've got glycinate, lysine, malate, and the citrate. You're just trying to maximize the pathway. So it's the same answer. But that is why it is in there, even though, I've gotten the question before, like, why would you put laxative magnesium in this high quality magnesium? There is a reason for it. And again, it's very little. So again, we'll assume that is causing loose stool. Give her another option. If you are using the magnesium for potentially any like restless leg or night cramps or cramps during the day, things like that, I would switch to the magnesium potassium.
Okay.
Because it's first of all, you're dropping the citrate. You're just going with the glycinate, adding in the the potassium, which would be in a very low dose. You don't ever recommend high doses of potassium unless it's medical. But there's a little bit of potassium in there, can help, if that's the reason why you're using it more in the cramping, restless leg at night type deal. If that's not the case, you just want to stick with magnesium alone. We do still have another option for you. It's the bisglycinate form. So another very well absorbed form, and it's in the powder.
Okay.
So you could control how much you use. Just for reference, 2 of the mag potassium provides a little less than 2 of the mag essentials, but you can essentially equate those, or else the math gets a little tough. 1 of the scoops of the mag powder, the bisglycinate, just because if she's changing over, she can compare what she's doing. 1 scoop is about 2 or 2.5 capsules of our mag essentials. Okay. So I'd probably recommend she start with half a scoop. Okay. So just start low and then work her way up. Ideally, I'd like to see her get to half to 1 scoop twice a day. But do it slow, allow your body to get used to it. And then maybe she can, begin to see if that's really causing it. But at least, there's other options for her.
But yeah, first try to figure out what's actually going on, because it's likely that this is not the cause. But if it is, those are all the steps you would take.
Exactly.
Cool. All right. Rosemary wants to know, I would love to ask, what can be done for varicose veins?
Yeah, I would definitely start this one as well with an examination by a specialist, specifically a vascular specialist, as it can be indicative of a, potentially another more serious issue, such as chronic venous insufficiency, CVI. So again, trying to take these issues as serious as possible. Yeah, I would start there. Now, what varicose veins, essentially, they're veins that become enlarged and twisted, as evidenced by sort of their appearance, whether it's on your lower leg or wherever. It's mostly hereditary. So oftentimes it's not it can't be directly attributed to like your occupation, let's say, or something that you did. Although there are certain occupations where, maybe you stood a little more stagnant in that way. Pharmacy. Like pharmacists. Yeah, definitely can, if there is a hereditary component, something that can potentially
aggravate
push that further. Yeah. Yeah. Now, for the most part, it's benign, but it can lead to further complications. If it isn't really painful or symptomatic, besides the cosmetic sort of burden of it, you can just sort of live your life and move without limitation, as long as you can tolerate that. Now, if it's something that you did want to intervene because it's painful, you can't tolerate standing, or there's skin issues, ulcers, not oftentimes, it has the potential, very low percentage, to have a malignant transformation, which it can turn into almost a form of cancer. Again, very low chance, but
we're talking like sub 10%. Okay. All right.
Yeah. Yeah. There is a risk of like bleeding with minor traumas if it's directly
Sure,
on the
I guess,
area.
yeah.
Clotting and then clotting throughout the body because of that, it can occur. Again, those are all sort of worst case situations. If you are in a situation like that, and we'll pretend theoretically she is, the most effective treatments are one of these 4 or 5s.
Okay.
4 or 5, which would be, there's laser treatment, there are direct surgical interventions, something called radio frequency ablation, sclerotherapy, where they essentially, I believe, inject like some sort of liquid chemical directly into the veins that can help them improve.
Yeah.
And then there's also like a medical adhesive or glue that has a similar, plays a similar role. Now, as far as anything that I can recommend over the counter supplement wise, not really.
Yeah, there's not. I didn't think there was.
Yeah, I mean, there are some supplements that you can do if this is something that's related to more of a direct cardiovascular issue, chronic venous insufficiency. There are some herbs and some things in some of our cardiovascular products that I suppose could help. But again, if this is just an isolated hereditary case of varicose veins that's maybe given somebody some issues, I think you want to go directly to somebody that deals with varicose veins.
Yep. Makes sense. Let's see. We are taking up all the time doing this. This is great. Joey, Brenda wants to know, she said, I have severe Gerd. The prescription I take gives me chest pain. What products do you recommend me to take?
Chest pain definitely is interesting for sure, in terms of that being the side effect she's saying she's getting. But again, be remiss to not mention, if you're talking about chest pain, make sure that, digging a little deeper in terms of what exactly the cause is.
Right.
I think she, Brenda would know that. But next, kind of what comes to mind is it the acid reflux itself causing the chest pain? So she knows she has GERD. She takes a med for it. The GERD's still acting up. The med's not working well enough. She's getting some chest pain from the acid reflux that's still active, even though she's on a med. That's a possibility.
That makes sense.
Okay. So that, again, would be something I would unpack if I was speaking to her directly, but just be aware. So can she pin down this was how she felt before a little bit? Can she pin down to, the original med initiation, as well as she can? So that's kind of first and foremost. Next, though, I'm assuming she's on a PPI, a proton pump inhibitor. It's the strongest class of oral meds that you take for severe GERD. There are a bunch of them, though. So even though they're in the same class, they're working the same way, it's still a different molecule. Your body may react to it a little differently. Recommend, it's very easy to convert between the strengths. Look it up very quickly. Maybe switch drugs to, again, staying within the same class. I don't want her to go grab some Zantac off the counter and say, I listen to some pharmacists say to do that.
Right.
Within the PPI range, with a doctor, with somebody making sure it's equivalent dosing, you could try just to switch the drug, staying in the same vein of therapy.
Okay.
So that's, where I would go next. There are, just a couple other things to mention. Now hers having severe GERD, I think takes some of this off the table, but there are protocols that come off of these medications. They've got to be done very carefully. We do them. Joyce does them. That's a very tight, specific protocol. You wean down off the med very slowly. You actually then start adding in a milder class of drugs, the H2 blockers, the Zantacs. Again, as you're coming down off the PPI, you start weaning one of those up. And then there's also some supplements that you can take, at least for the symptoms. So we have acid block. It's really can just help to soothe the GERD that she's getting. But again, it's if she has, Barrett's esophagus or anything like that, she's been documented not just to have the acid reflux, but that maybe, there's some damage to the esophagus. Those put everything off the table supplement wise or weaning off. I still think changing the med has an outside shot to work because you're getting the same therapy.
Right.
But again, if it's gotten to the point where there's been physical changes in her esophagus, there's no recommendation of weaning off or anything like that.
Fair enough. All right. Last one, Dante, you ready? All right, this one's coming to you. Reba from Facebook said, what kind of supplements are a good choice for preteen girls? I know they will need something for healthy bone growth and to focus on diet as their hormones can cause chaotic results. Okay, that's the email. I didn't say anything about chaotic hormones, so don't email me about it, okay? How do we help Reba?
Yeah, I don't have like a stock regimen of supplements for preteen girls or anything like that. But I would say, just breaking down the question a little bit, in order to maximize healthy bone growth, muscular development, all that kind of stuff, the same recommendation we would give older individuals is to meet or exceed physical activity guidelines.
Yep.
And that's all the necessary resistance training and movement and aerobic conditioning. All of those sorts of things will have a profound impact on how your bones develop. So bigger than any supplement could. Now, if there's a specific reason that, there's a deficiency in bone and whatever else, then that's a different conversation. But yeah, that's an easy one to recommend. Eating a varied diet goes in tandem with that, but with preteens in general and younger adults, that's can be challenging. And then also just advocating and educating and helping them get ample sleep helps with all of those things that Reba's looking for.
Yeah.
The only real supplement recommendation, there's a few. What I'll start with from a supplement perspective would tie back to this idea of eating a varied diet, which can be challenging. As a parent, I'm sure it's challenging to get somebody younger to do that.
Yes.
So maybe in that case, a multivitamin or a greens powder, something of that magnitude wouldn't be a bad idea.
Yep.
I mean, there's gummies, there's capsules. You can open the capsules that we have. There's liquid. In addition to a multi, you could do omega-3s. Again, especially if dietarily it's lacking. They're not big fans of, fatty fish or salmon. That's something to consider. Something with a good balance of EPA and DHA, which we obviously have. Probiotics in the same sense. If there's some sort of holes that are glaring from a dietary pattern perspective, you could do that. And then again, another recommendation that we put forth to adults would be always having some protein powder on hand.
Yeah.
Especially with kids, preteens, kids, whatever. Something that I've noticed with nieces and nephews and other kids is, in having a juicery down the street, is they love smoothies.
Yeah.
And so if you are having a hard time, getting them to eat or want to eat a balanced plate of foods, having a smoothie a day with a scoop of protein in there is a surefire way to ensure that some of those nutritional needs are met.
I love it.
Fish oil, multi, probiotics, and then protein powder.
And resistance training.
Yeah.
Makes sense. Well, that was a lot. Man, I can't believe we actually got through all those. I thought we might have to cut a few of them. Really excited. Guys, all this. All of the products are available on our website, askjoedimatteo.com, askjoedimatteo.com. That's also where you can find past episodes of this show, find the classic show that started all of this, sign up for the mailing list so you know when things are going on sale. One of the supplements that maybe you heard about, you need to pick up. They'll all be there. AskJoeDiMatteo.com. If you have questions, if I haven't said it enough yet today, questions at AskJoeDiMatteo.com is an email address where you can email us and we will answer the questions just like this. It's amazing. Show notes, anything that we mentioned. I wish we didn't reference any articles really on this, but typically show notes are down in the show notes section on the podcast or the video page. And if you're only listening, there is a video segment to this as well. You can watch the video where we have these conversations and see when maybe Joey's or Dante is playing footsie with me under the table and we make awkward eye contact. Thank you so much to Josiah Schweinberg for running the cameras, Michael Deppish, our editor, Joyce Gibb, our nurse practitioner who handles private consultations, Diane Silverman manages our products, Terry does scheduling, Cecilia does distribution. That's Joey DiMatteo. That's Dante DiMatteo. I'm Tyler Andrews, and now the question is up to you. Now that you've heard, what are you going to do? Are you going to just enjoy this and listen to it, which is great, but also you can take some of what you've heard, put it into practice, and be healthier yourself. We want you to be part of this generation, Generation Health.